All right, good afternoon, everyone. We're going to go ahead and get started because we do have a lot of material to cover today. And we know folks will be trickling in, and that is okay. We can catch them up as they come. But my name is Melissa Williams. I'm the Associate Director for Policy and Field Advocacy. And today you are here tuning in to our Be a Legend training. This training is focused on how to lead your own focus group or listening session as part of our Be a Hero, Make a Plan campaign. But you'll see that this training could actually have multiple applications, and we'll kind of talk through that as we go. Before we go into the training, just several housekeeping items here. We ask if you could please mute your lines. And just because we are recording this for others who can't join in live. If you have questions, please enter them into the chat. We will have time at the end of the webinar today to go over your questions, but if there are some that come up as we're going through the training that are relevant to answer, I'll do my best to get to those questions. We also ask or invite you to please turn on your cameras. We love to get real-time reactions. So seeing your faces is always something we appreciate, but no pressure, and absolutely understand if you don't want to. I hear you. And please complete the evaluation at the end. We just have a couple questions just to make sure that that we're meeting the mark. We want to make sure that we're actually addressing the questions you have related to your advocacy. So please let us know how or what you thought of this webinar. Be a Hero, Make a Plan. This campaign is made possible because of the sponsors listed here, Johnson & Johnson, Bristol Myers Squibb, and Grail. So we thank them for their support. And here we are. So if you participated in our kickoff call last week or participated in the Be a Hero, Make a Plan campaign previously, you know that we have outlined 3 levels of actions that you all can take. So, you can be a sidekick, you can be a hero, or you can be a legend. And this training is really focused on those legend actions that you can take, specifically on how you can host your own focus group. So this is a new action that we have included in our toolkit. You'll see it's just below how to host your own care planning workshop. We did do a training last year focused on how to hold or organize your own care planning workshop. And so we have a link to that recording if you're interested in learning how to do that. We actually encourage everyone to see that. We're actually really proud of that, that presentation. We think it's really helpful. So tune into that training if you haven't already, but the focus for this workshop today is really on how to host your own focus group. And so what we're going to be covering today are the basics. What's a focus group? Why are we using it? Why is it an advocacy action here? Then we're going to go into the details about how you organize your own focus group and facilitate your own focus group. So just 3 basic things that we're going to cover today that we think will really help you in terms of your advocacy. But before we get started, I really just want to get a sense of where people are. So we're going to launch a poll and we're going to ask, have you ever participated in a focus group or listening session? I think Mary will launch that as soon as she's able. All right, is it popping up for people?
Yes, it's popping up. We have quite a bit of responses. Okay, I'm going to end the poll. I think we got everyone.
Great. Can you read off the responses? Because I am not able to see it.
Yes, so about 90% of people said that yes, they have participated in a focus group or listening session, and 10% said that they're not sure.
Okay. All right. And so next question that we have for you, have you ever facilitated a focus group or a listening session? So Mary will launch that as well.
Great, we're getting some answers. Okay, I will go ahead and end the poll. I think we got everyone. We're split 50-50.
Okay.
Yeah, 50-50 from everyone.
All right. So some people have had exposure. So what I'm probably going to be sharing here today might not be new, but hopefully it'll be a refresher. And for some, hopefully it will provide some comfort if you decide to host your own focus group or listening session. So right now, we're just going to go over the basics of what is a focus group, what's the purpose of them, and kind of just walk through just the basics. So a focus group or a listening session, I'm going to use them interchangeably, I think, just for ease of just less syllables, less actual letters. You'll see focus group reflected on these slides, but know that it can be used interchangeably with listening session. So a focus group or a listening session is a type of research method that brings together a small group of people to answer questions in a safe and moderated setting. It's a useful way to gather people's opinions, their ideas and beliefs on a topic or product. And just one thing to note that, a focus group is not a training. It's not an opportunity for you to impose your viewpoints. The purpose for the focus group is really to hear from others, their opinions, their ideas, right? And so that, just want to make sure people understand that distinction. If you really wanted to do the training, then that would be the workshop where you can really teach people on how to have it, or the importance of having a care plan. The difference here with a focus group is we want to get people's opinions about why they have a care plan. Why don't they have a care plan? What would make it easier for them to have a care plan, right? So just want to make sure people understand that distinction. And Mary, I'm going to just flag, I know we have a small group, so if people have questions and want to interrupt, please just raise your hand. Mary, I'm going to kind of rely on you to select people as you see if there are questions that come up or questions in the chat. So when are focus groups used? You'll see that focus groups are used in market research, term testing. Some of you who have been volunteers with us for some time have learned that palliative care, for instance, has been term tested in focus groups to see whether or not people actually understand the words palliative care and know that it means, not just hospice care. So that's an example of sort of the term testing that's used. We see it used in other industries to sort of assess people's experience with either a product or an experience. Oftentimes when people or when organizations are launching a website or a business is launching a new app, they will use focus groups to get feedback on what that experience is before actually launching it live. Focus groups are also used to generate new ideas, and it's also used for evaluation purposes. And partly what you all, if you guys do host your own focus groups, and we absolutely urge you all to do that, largely it would be around that evaluation and sort of people's experience around care planning. So you may want to know, like, why do a focus group as an advocacy action? Many of you may be volunteers with other organizations, other patient advocacy organizations, and might not really be exposed to hosting your own focus group. Like, oh, I'm so used to being the person that's a part of a focus group. I never thought that I would be the one to host or facilitate it. And here we think you all are equipped to do that. And we think it's actually an important advocacy action because we think it allows you to really hear and listen to the concerns of your community. We think it's also an opportunity to help identify any gaps that might exist, that either NPAF or maybe another local organization can help fill. And we also think it can help position you as a leader or influencer within your community. And I'll say more about that later. But those are sort of the three main things that we see as important as far as why you all should host your own focus group in your community. And so now I'm going to just pivot over to what steps are needed to be done when organizing a focus group. And if you've tuned into our training last year that was focused on how to host your own workshop, you'll see that these steps are actually pretty similar, but there's some things that are just a little different, and I'll go into that. So when organizing your own focus group, the first thing you want to do is to identify the topic. What do you want to learn? So we have actually made this easy for you all in terms of using this as an advocacy action for this campaign. The topic here is really focused on care planning, right? But if you were, even outside NPAF and really just wanted to, host your own focus group, really get a sense of what people are thinking or where they are in your community, here's some of the things that, you can consider, you just consider some of the questions you want to ask. What is it that you want to learn? What do you want feedback on? And it could range from, what sort of policy gaps might people be experiencing? Are there resources that can really better help patients and caregivers? If you work in the healthcare space, in a facility, sometimes, there's a lot of sort of evaluative things people can ask in terms of really gauging that patient caregiver experience. And so take some time, make a list of those questions. For the purpose of doing a focus group for us, we actually have a tool for that we'll share with you following this webinar. So we take some of that work out, but the questions that we ask are largely related to care planning. Like, why should people have a care plan? What do people think of when they hear the words care planning? What would make it easier for someone to start a care plan? So we have some questions that we've outlined, but by no means do you have to stick to them. You can think of questions that can be better tailored to who you want to reach. So that leads me to step 2. When organizing your focus group, you really want to think of your audience. So what perspectives are you looking for? If you attended our kickoff call last week, you'll know that our target audience for the Be a Hero, Make a Plan campaign is focused on young adults, underserved groups, and patients and caregivers. You can certainly reach out to any of those groups and invite them to be a part of a focus group. But you might also want to get the perspectives of healthcare professionals, or nurses specifically, or people who work in the administration. It's really up to you in terms of who it is that you want to reach. Other things to consider in terms of, who you should invite for this focus group are your spheres of influence. Who do you know that would be interested in care planning? And also consider your comfort level. Maybe you might not feel so comfortable reaching out to people in your community. Maybe you're more comfortable reaching out to people you know. So you just want to get the perspectives of your family, your friends, coworkers, neighbors, maybe your support group or members of your church. That is totally fine. But maybe you are someone who feels more comfortable connecting with members of your community, and that's totally fine too. When thinking about the size of your focus group, we say that you shouldn't have more than 12 people. Any more than that might be a bit too cumbersome to moderate, and you really want to give everyone sort of equal opportunity to share their perspectives. And so actually a size of about 8 to 10 people is actually ideal. And I have a note here that it's okay to combine different audiences. Of the target audiences that we've outlined, you can have 2 or 3 people from each of those groups and bring them all together, and that's okay. And sometimes you'll find that the more diverse your audience is, the better, the more perspectives you'll gather. So just something to keep in mind. And we also have a little pro tip here for those who aren't sure of how to reach out to these different participants. We do have an outreach checklist that you can use to recruit participants. And it's a new resource that we've included in our toolkit this year. And this is actually completely usable. You can actually click the different boxes and check off the groups that you've reached out to. And we are using it as a way to collect information. So if you're using this as a tool, you're welcome to share this with us, so we can kind of keep track of where everyone, the groups you all are reaching, and sort of assess our collective impact. So moving on to sort of the logistics of organizing the focus group. And this is very similar again to if you're hosting a workshop. These same things come to mind. So date and time, select a meeting time that's accessible for your participants. So take into account work schedules, childcare. If you want to meet with your coworkers, maybe it's using your lunch break. If it's your family and friends, maybe it's like a weekend time that you decide to get together. Or, if you're really trying to reach a broad group of like patients, caregivers, just consider some of the logistics that are involved, and making sure that you find a time that's really accessible for everyone. We have options for, if you decide to have your focus group virtually or in person. We know some meetings are now beginning to take place in person. So if you feel comfortable doing that, you're certainly welcome to host a meeting of that nature. But if virtual is what works for you, that is totally fine. We do have some tips on what platforms are best to use. You can meet over Zoom like we're doing right now. You can use Google Meet or Microsoft Teams. I think there are pros and cons to all of those different platforms, and there may be others that I'm forgetting. But I do have a note here that if you are interested in hosting a virtual focus group, that you are welcome to connect with us here at NPAF, either Mary or me, to use our Zoom platform to host that. But Google Meet is also another option. It's free for, I think you just need to be a Google user. And I think it's free for about an hour. So there's some logistics there that we can get into a little later, but we'll also note it in our toolkit. If you are comfortable meeting in person, consider the space. You can use meeting rooms in your public library, churches, or other sort of community centers. And sort of a plus or a good way to make sure people show up is maybe have some food available, right? Maybe asking some local businesses to donate some good baked good sandwiches, depending on when you are meeting. And if you need sort of additional support on how to do that, needing a template letter or anything like that, let us know. But sending the meeting or scheduling the meeting, we ask that you send the meeting invitation via email. Because it's a focus group, there's really no need to send it using either social media, like creating a Facebook event or even using Eventbrite. Focus groups are meant to be small. So just having that sort of personal touch via email, we think will be really strong. In your email, make sure you include the date, time, the length of the meeting. And we think anywhere between an hour to 90 minutes would be sufficient for a focus group. Make sure you share the purpose of the focus group. And that's because you want to hear perspectives about care planning. If you're meeting virtually, make sure you include that meeting link. And if you, again, meeting virtually, give that heads up about turning on cameras, because that is sort of another tip that we include for those who are doing a virtual focus group. So I'm going to pause there because I am saying a lot before we transition to facilitating a focus group. Are there questions in the chat, or anyone have a question they want to ask out loud?
We have one question from Elena. I think you may be able to answer this quicker than I can type.
Okay.
So she is asking, when you say patients, who exactly do you mean? Anyone can be a patient at any time.
That is exactly right. It could be, so when we say patients, it really could be anybody, right? And that's sort of another sort of layer to this, this campaign. Anything regarding our health can change at any moment, right? You can become a patient at any time. You can become a caregiver at any time. And so when we say patient and caregiver in the context of this campaign, we mean people who are actually living or dealing with a complex or chronic condition. But it could also mean people who are young and healthy, who aren't worried about that. It could really mean all of those things. So I hope that answers the question. Mary, I don't know if you have any more to add.
Yeah, no, I think you answered that well. Yeah, so that is exactly right. Absolutely. Anyone could be a patient, but as Melissa mentioned, typically referring to individuals who find themselves more so in the patient position or patient role. And, to extend what Melissa was saying, I think it's important to have that conversation with people as far as, maybe anyone at any point can visit the doctor more than 1 or 2 times a year, especially with COVID, right? And many people may have found themselves within that caregiver position. And so care planning is such an important aspect of having these conversations of, okay, well, I didn't necessarily consider myself a caregiver for, my sister or my parent or my neighbor. But now that I understand, it could be something as simple as I'm getting groceries every week for my neighbor. I'm caring for them and checking on them, making sure that they get their at-home tests, whatever that may be. Having these direct conversations with people about how would you like to be taken care of? What are some things that I need to be aware of and I should share with your care team in the event that you may no longer be able to speak for yourself. So yes, that's typically how we are looking at patients and caregivers in this sense.
Thanks for adding that, Mary. And I do think that's helpful. I know I kind of just jumped into this training, and it was really under this assumption that you all have had exposure to our care planning guide or know what care planning is. But if there is at any point where you need us to, go back and, explain something in more detail, please let us know. All right. Are there other questions? Or if not, I can move on, and we do have time set aside at the end for more questions. All right, so I'm going to go ahead and continue. So facilitating a focus group. So some of you have indicated that you have been in that role of facilitator before, but some of you have not. And so for those who have been in that position, I absolutely invite you to add in your tips to what I'm sharing here. There's not a formal science to this. I know focus groups, there are methodologies that we'll get into, but for the purposes of what we're talking about as, bringing together a group of people to get feedback on care planning, it's not, it's a conversation. So here, the definition for facilitate is to make an action or process easier. And your role as a facilitator is just that, right? Is to make people feel more comfortable talking about their experiences, and really making that, a safe space or making the focus group a safe space for people to share what's on their mind. So the start of a focus group, open up with just introductions. As the facilitator, introduce yourself, explain your role, purpose for the focus group. If you're convening people who already know each other, maybe it's, a group of your friends, family members, introductions aren't really necessary. But, if you have people who don't know each other, it may help break the ice and kind of give people that sort of assurance and comfort. So really that sort of point is left up to the facilitator's sort of exercise. Introductions do take a lot of time. So just know that in terms of when structuring the timing for your focus group. And here's a script that we've included for, if you are, hosting your own focus group, here's something that you can share. So I have here, my name is Melissa, and I'm a volunteer with National Patient Advocate Foundation. I've asked you to participate in this focus group because I want to hear your perspectives about care planning. I have some questions that I'll be asking, and I'll be jotting notes as you're talking. There are no wrong answers. The goal today is to have a conversation about care planning. And your feedback will be used by National Patient Advocate Foundation to help people start a care plan. So that's a script that you can tailor it to your voice, to your community. But that's a really great way to sort of set the tone for the focus group. Another thing you want to do at the start is set ground rules. So we ask that you consider a community agreement. And that's just sort of a list of just general things that, participants of the focus group abide by. And I'll show an example on the next slide. One thing I think is a really important rule is to urge participants to raise their hands to speak, whether it's in person or virtually. And an example of a community agreement is one that we have here. Some of you may actually be a part of our COVID-19 learning community. And this is the community agreement that we have, that we share front and center at the start of every workshop meeting that we have, just to give people that reminder that everything that's shared in that workshop is to be kept confidential. We want people to be present as fully as possible. We want to balance between listening and talking, and know that with focus groups, you're inviting different perspectives, and we really want to make sure that we say out loud that we're there to respect the differences, and we want to be open to new concepts and ideas, and that it's totally okay to take a break if you need one. Sometimes what's shared during focus groups can be a bit heavy, can be a bit emotional, and it's totally okay to take a step back, to hit the pause button if you need it. So this is an example of a community agreement. We have other examples that we're welcome to share if you're interested in that, but it's definitely something that we think would be really helpful in sort of setting what those ground rules are at the start of a focus group. Another thing to consider at the start is the seating arrangement if you are meeting in person. So make sure you arrange seats in a circle so that you all are facing one another, or you can sit in a round table if that's available. As a facilitator, it's important that you mimic the behaviors of your participants. So if they're seated, you should be seated as well. And again, it just sort of shows that you're at their level, right? You're not there to instruct. You're really there to gather feedback. So you really want to, again, just mimic what those behaviors are of the participants. And if you're meeting virtually, invite people to turn on their cameras so you can see real-time reactions. If you've participated in our webinars more than once, you'll note that that's something that we say often. Again, it's really just because we want to see those real-time reactions, but certainly there's not a requirement to do that. But I do think for purposes of holding a virtual focus group, you can call that out at the beginning. So that's something that you can note in your email invitation that you would like for them to have their cameras on so that they're prepared. So that's just a little tip there. And some other tips that would be helpful as you are going through the questions of that, that you've either drafted yourself, or if you are using the questions that we have included in our tool. Here are just some things to keep in mind. So make sure you have pen and paper with you to jot down any notes. Again, that's something you'll say up front at that introduction, that you'll be taking down notes as people are talking. I think it's important to say that so people know to expect it. Make sure you maintain eye contact when possible. Obviously, as you're jotting down notes, it might be a bit difficult to maintain that eye contact, but again, we really want to make sure participants feel comfortable. So keeping that eye contact is important. After you ask a question, pause and gauge reactions. You might find that people aren't really quick to respond, and that's okay. You can repeat the question or ask it in a different way if you think people are confused. You can even ask them, do you understand what I'm asking? And really use that as a way to invite some conversation. Another thing to note that can be helpful as you're asking questions or as you're drafting what questions to ask in a focus group is to make sure you ask open-ended questions. And the example I have here is, there's a difference between did you have a good day and versus how was your day? So you really want to not ask questions that yield yes or no answers. And that can be really difficult. It does take practice to learn that. And if you find that you ended up asking a yes or no question, that's totally okay. You can use words like, describe that to me, or describe what you mean, or explain more, tell me more, and follow up to sort of get people to, to share a little bit more about what they mean. And again, a lot of the questions that we include in our tool are not those yes or no questions. But sometimes you have to read the room. And maybe the questions that you have drafted might not actually fit the conversation that's happening. And so it's important, as you're listening to the participants, to follow the conversation. It's okay to ask questions that aren't reflected on your questions list. There may be some viewpoints, some perspectives that are raised that you didn't really consider that are important to expand. And so, allow that opportunity to happen, and jot those notes down. That's important for us to know. Let everyone know that they have an opportunity to answer a question. If you hear, sometimes in focus groups, there may be one person who is very open to sharing his or her experience, and that's totally okay. But you might also notice that there are some people who are a bit more shy, and it's important to sort of help them or make them feel comfortable to share their perspectives. And so you can absolutely follow up, like, what other thoughts do people have? Again, this was something that I had said in the script, but assure participants that there are no wrong answers. You're there to just, simply gather their feedback. And really, as a facilitator, it's your job not only to make it easier for people to share, but it's your job to listen. We really want to hear their feedback. The extent of what you should be saying really should be the questions that you're asking and really drawing people to sort of share or explain more. And again, I just want to underscore that a focus group is not the place where you teach, right? That's the workshop. The focus group or the listening session is really, it's about listening. And the last point here is just to remember that you're an advocate and not a researcher. And so focus groups, yes, it is a type of research method, but the way that we're using it here is really just to start a conversation, to spark a conversation within your community, to get people talking about care planning. And we don't want you thinking that as you're hosting a focus group that you're doing something wrong. Chances are that you are not. And we're not going to be publishing any of this. The feedback that we'll be using is really just to make our resources better and to make our campaign better. So just know that going in, that you're an advocate first and foremost. You're not a researcher. We hope that will be some assurance for you. Some additional tips and possible scenarios that you might come across, and I think I kind of touched on this a little bit already, but you might have instances where the focus group is quiet. The participants are quiet. They're not responsive. And that's okay. Use that silence. If people need a moment to reflect on the question, do so. Try rephrasing the question or asking. If after all those things, people still aren't really sharing, you can offer your own perspective to jumpstart the conversation. Like I started a care plan because that's also a tactic that we've indicated for people to use when just talking to people about care planning, like, sharing your own perspective, and that might make it a little easier for people to start sharing their own perspectives. Sometimes you might have a group that's really rowdy or really excited about it, and that's fine. Just remind participants about the community agreement, especially if you see people are talking over one another, interrupting each other. Just give that gentle reminder and encourage people to raise their hands. It's likely that, if you have a rowdy crowd, that, sometimes the topic might get a little sidetracked. And again, that's okay. Just acknowledge that shift. As the facilitator, it's your role to bring it back to the original topic. I think I also touched on this before. You might have people who speak more than others, and really a way to invite others to chime in is to, just ask if there are others who agree or disagree with that perspective, and offer that you really want to hear other perspectives, but also let the person know that you really appreciate their feedback or their insights, and offer to reach out after the meeting to learn more. And again, because of the nature of the topic, you might find that emotions may be high, and that's okay. And you can acknowledge those emotions, allow for a pause, allow for that person to take a break if they want. All of those things are okay. There are probably other scenarios that you all may have experienced for those who are facilitating, but those are probably some of the more common ones that we thought would be helpful here. Now, at the end of the focus group, really, we want to make sure you honor the time allotted. So if you said that you're meeting for 60 minutes, make sure you stop at that hour, or after that hour. 90 minutes the same. Make sure you thank everyone for their time and participation. And because the focus for this focus group is really to get feedback on where people are in care planning, what their thoughts are. Share NPF's care planning guide as in follow-up, and that can be something that can be shared via email if you're meeting in person or virtually. If you're meeting in person, want to have printed copies, that's fine too. You can let Mary or me know, and we can either send printed copies to you if that is what you prefer. But really, that's just sort of the way to end it. Again, really just sort of underscoring again, just sort of the importance of just really thanking people for their time. Showing up is often the hardest part. And again, like you showing up today, it's we're very, very appreciative. So the next steps after the focus group is done, circle back with us, share your feedback with NPAF. So again, we'll have a tool that you all can use if you do have that focus group, where you can write your notes in right there, or you can even just send it to us by email. It's appropriate to follow up with participants maybe a week or two afterwards. Ask if they completed the care plan. I think it would be really great to see if we can gather some data around if people, after participating in the focus group, how many of them have actually took that action to complete a care plan. And then another thing that you can do, and sort of what makes hosting a focus group a pretty great action, is that you can brainstorm other actions that you can do that address some of the concerns that were raised. So for instance, if some people are just like, I didn't know how to start a care plan, or I don't know the first thing, then maybe the next step is like, okay, well, maybe people need to have a workshop around how to host or how to complete their own care plan, right? Or maybe it's, connecting with primary care providers and asking them to use the care planning guide as a way to better connect with their patients. There are a lot of different actions that you can do. And Mary and I are here to help brainstorm what those actions can look like. And we also recommend consider drafting a letter to the editor. It's another advocacy tactic, but we think it's a great way to sort of summarize your experience hosting that focus group, what the feedback was, what are the potential gaps, and the letter to the editor is a great way to get people in position of influence to really make a difference. So specifically policymakers, healthcare administrators, that is a great way to sort of draw their attention to some of the issues that might be that many people many people participating in the focus group that might be experiencing as it relates to care planning. And so now the impact. Why is hosting a focus group or a listening session, why is this a legendary action? The feedback can really help us at NPAF hone our resources and campaign actions for next year. And so in many ways, we're using this as an evaluative way to get feedback. We always want to be doing better. We want to make sure that the resources that we build, the actions we ask you to do, meet the needs of your community. And this is one way for us to gauge that. And the other thing that I think that really makes this action so important is that it positions you all as a community leader. And that's something that I said at the start of this training. And this is really important because we have many volunteers who come to us who are just like, I don't know how to do this. I don't know who I can contact. Maybe you're a little, you haven't done it before, but it really allows you to sort of flex that muscle to, you can use your outreach checklist to be like, okay, well, these are the people I need to reach out to. And I think ultimately it shows that you can organize, you can convene, you can listen, you can address the problems of the members of your community. And policymakers, again, people of influence, they look to people like you to make sure that what they're doing meets those issues, right? So it's something that I think that is a really important tactic that you can do. And just a final note that it's one that, it's an action that we might not reserve just for Be a Hero. We might be using it for other grassroots initiatives too. So if you've been a volunteer with us for the last couple of years, you know that we have different campaigns during different times of the year. So we may ask, have a focus group with caregivers in your community and have them share what resources they need that can better support them. Regarding our needs navigation work, we might ask you to do something similar around that. So know that this training, while it's specific to our Be a Hero, Make a Plan campaign, it's an action that can be done for our other initiatives. So keep that in mind. And I think that's where I pause and take your questions and hear from you. What questions do you all have? Mary, you're welcome to sort of moderate the chat, but people are welcome to unmute and ask their questions out loud.
Tony K has a question.
Yeah, thank you, Melissa and Mary. This is really helpful, refresher, great content. I got two things. One, I'm wondering, is there a time frame that you want this information gathered? Because I'm trying to work with groups that I might be going into May or June. And so I'm just kind of wondering, is there a cutoff, or can this stuff trickle in, in the next few months? And then I did have a comment on when some of the, one of your slides had that you'll be taking notes, on paper and pen. And when I've attended different gatherings and someone is taking notes, but they're typing on a computer, a laptop, something, to me, that maybe it's just my age, I don't know. I just think that is very distractive compared to someone using a pen and paper.
Thank you, Tony. And I would agree. And I think that's probably why we indicated pen and paper, because it's for, we're patient advocates, right? Sort of that experience that we have when we go see our doctor and they're just in front of their computers as you're trying to describe what issues you're going through. It is distracting. And so it is helpful to actually have a written utensil. And I don't think it shows your age. I agree, Tony. And I think it's a good practice. Thank you for that, Tony.
And then the time frame.
Oh, yes.
Yeah, sorry about that.
No, it's no problem. Thanks for reminding. That's a great question. And really, you can do this at any time. We're going to be collecting this feedback all year long. So there's no real time constraint other than saying, I guess what, Mary, I think by the end of the year, like the calendar year, just because usually by that time, we're sort of starting to think of how we improve the campaigns for next year.
Right.
What
Yeah.
do you think?
Absolutely. I would say that for the purposes of the campaign, just so we're able to sort of have an idea of what the collective impact may be throughout the month of April, and to get a good idea, as to what types of resources and what type of funding should be set aside for the campaigns. It's helpful to just sort of have an idea up front of, okay, we have 5 people who are interested in hosting these workshops, and they're going to do one in April and another in June and another, and we understand you're not going to map out your entire year. Sometimes it's just dependent on what the needs are in your community. But even if you just have a super small focus group of 3 to 5 people, and you're able to do that in April, that would be phenomenal. But as Melissa said, of course, this is stuff that we're going to be doing throughout the year. And we know, Tony K, this is certainly an initiative that you champion throughout the year. That's something that we are going to support, and want to make sure that we're supporting you in your advocacy in this area. So while yes, there's no strict time commitment on collecting this information, we would certainly encourage even just a smaller focus group, even with community leaders, and see, have you thought about having a roundtable discussion or focus group with community leaders? Have you thought about what our community members thoughts are around care planning, especially around COVID? Is this a communication that would benefit our immediate community, or this particular community that we're focusing on, the limited resource population, whatever that may be? I think that would be super helpful to have ahead of time. There's some questions in the chat, and then I know Tony Sowry raised his hand as well. In the chat, we have a question from Lisa, and she's asking about, previously many studies that she's been a part of, there's IRB approval to pay participants to participate in studies and focus groups and listening sessions. Any suggestions for incentives outside of paid participation? So
Go ahead, Mary. Go ahead, and I can chime in after.
Yeah, that's a really great question. You're not always going to get luck 100% of the time, and that's okay. There are individuals who really can't afford to extend their time or their experiences, their expertise without compensation, because they do have very limited time and they want to protect that, and that is okay. And we certainly want to be respectful and mindful of where everyone sits. And there are people who understand that this is sort of a volunteer opportunity that has the potential to really benefit and progress health literacy within your immediate community, and may not mind taking an hour of their time to participate in this type of engaged discussion or conversation. So as far as incentives, I think just how lending their expertise and time kind of is an incentive. You have the ability to really reshape or improve upon or better what the health landscape and understanding of it within your community, what that looks like based on their direct feedback. And then you having the opportunity to, sort of add these different layers to what you're trying to do with care planning. And that may be enough for some people. Melissa, what are your thoughts?
I really like how you worded that, Mary. But I think the question that Lisa asks is a very good one. And I know in terms of like the research side, that is certainly something that is taken into account in terms of making sure that we honor people's time, right? And we believe us. We're huge proponents of that. But I do think it might be also worth a discussion here to hear what people might think. Do incentives need to be provided to get people to participate in a focus group? I'd be curious to see, because this is the first time that we are really listing this as an action, like what the response is from the community. We also have I think we have that option to have we can enter names into a drawing for a gift card. And if that is something that you find that might actually appeal to attracting people to participate, then I would highly suggest, working directly with Mary and me, because we can make that happen. I think, there are probably other things in terms of, as this is, for, NPAF grassroots purposes, there's, maybe some swag that we can give away. But that's a really, really great question. And I think it's one that we can really, we can talk about more. I'm curious to hear if anyone else has some reactions to that.
While we wait on some of that to come in, Lisa also had another question about how about recording for review and capturing notes. My suggestion is yes, but definitely make participants aware of that ahead of time, and just see if they're comfortable with being recorded, and even with taking notes sometimes as well. I know Tony Sowry had his hand up to ask a question, and then Tony K after that.
Yeah, thanks, Mary. Thanks, Melissa. I just wanted to, I was encouraged to hear, I think I heard you guys saying this correctly, that it's okay, we don't have to get into this campaign immediately now, because it strikes me, A, because I haven't been very active this week, and B, because it strikes me that this particular campaign is not, it isn't really that central, that it's not like our Get Covered campaign in the autumn, which is really time sensitive. And to that point, I am trying to piggyback on some local community groups here, which this particular subject, I think, is going to be quite, well, I hope it's going to be interesting to them. And these groups span the sort of age range of people in the community. One is a senior orientated community group. The other is a block by block residential community group centered on having an emergency response team for earthquakes and fire, and using that group to promote making a plan, which is multi-age, that group. I've already had some people sort of say, as I reached out to them, well, we're too young to make a plan. It's like, really? So, in an earthquake, you break your leg and you can't talk and you're separated from your family. So anyhow, that's where my thinking is. And the fact that you're okay with us just waiting for the opportunity really helps me, actually, because otherwise I have to sort of push my way in through their door this week. So just wanted to share that.
Thanks, Tony. I was just going to say, Tony Sowry, it's you're right. There's no time sensitivity around this campaign at all. The only reason why we have this in April is because nationally, April 16th is National Healthcare Decisions Day. That's this Saturday. And there's usually a sort of a lot of conversation around care planning, advanced care planning, advanced directives around this time. And so we wanted to be a part of that conversation. This is our way to do that. But care planning is always important, and it can take place anytime. So I hope that makes you feel better, Tony, that you can sort of, feel your way with the group and sort of introduce it in the time that feels right for you.
Tony K, I can't pin you for whatever reason, but go ahead. And then Lisa Brown after.
Oh, I want to make sure everybody's got an opportunity, but there was just too many thoughts I had on that question about being able to pay someone for their time or, provide that. I really struggle with that. I get a lot of invitations to participate in research, and I like the drawing part of it all, because then you're not favoring one person over another, and everybody's got an equal opportunity. And I was thinking, well, maybe gift cards of giving gift cards away, but yet in one group that might be our unsheltered community members, they may, feel like, hey, for me to get this gift card, I've got to do this, compared to other individuals that may not struggle to come up with $5 for a cup of coffee or whatever. So I think that that's an excellent question. And I think the drawing is the way that people have equal opportunity and they're not feeling that pressure that they have to do it.
Thank you.
I
for
couldn't
that,
type all
Tony.
that.
Oh, no problem. Thank you for sharing, Tony.
And Lisa Brown.
Thank you. Some of what the gentleman was saying, I forgot his name that quickly,
Tony.
but Tony, yes. He generated some thoughts for me, and I was just thinking about how you could partner with the Red Cross in their disaster preparedness or their CPR trainings and things like that. And then community finance classes that people have through housing programs, because they're usually talking about insurance and they're talking about, all the things, and how that could be a good way to, bridge this conversation. And then the other thing I was thinking about for my community, I'm in Charlottesville, Virginia, and we are welcoming a lot of new community members. We have a refugee center here. And so as we're like how to get this information to those folks, they're probably bombarded right now with lots of things. We have a lot of different community initiatives trying to help. But, how does that work out? And then not, also for people who don't, English is not their first language. So.
That's really great to take into consideration the makeup of your community and reaching out to, okay, of course, everyone can generally benefit, but when you have a particular area of focus that you would like to communicate the importance of care planning, what it is, how to get the guide, or, if you need us to print out some care plans and then send them out to you. And as far as the language, what's another dominant language in your community?
Oh, it varies.
A lot.
Dari and various, so we have a lot of new community members from Afghanistan, Republic of Congo. Now, we're anticipating Ukraine folks. So it varies.
So there might be, so every community is different, but there typically communities that take in some newer community members are a bit more well-funded. And within these areas of funding, there may be individuals or programs, funded programs that exist to be able to translate certain documents. And so if they find this to be something of importance that they're able to help acclimate these new community members onto, having that conversation with those, I don't know if they're going to be county council members or local nonprofit organizations, but connecting with them and making them aware of this and sharing the care guide. And I'm sure that they'll have people available on staff to have these resources translated for people in your community. That may also be another way to reach out if you feel it's appropriate. These are really great ideas.
They are. Thank you so much, Lisa. And I noted I'm actually not too far from you. I'm just over the mountain in the valley.
Oh, that's where I grew up, in the valley. In
Yeah.
Stanton.
Yeah, I'm not too far from Stanton. So yeah. How about that? Small world.
Yeah, it is.
All right. So I know we had only blocked off an hour for this webinar or this training. So we are 5 minutes past. So we appreciate those who are still on. We'll give a last call for questions. And then I think we can wrap up.
And we are absolutely going to be sending the PowerPoint deck, the recording to this training. Melissa and I are available via email. So please reach out if you have any questions, and you'll see the email in the follow-up. And yeah, if you have any questions, please let us know. You'll also, in that follow-up email, there's going to be a link where if you would like to request some resources be printed out and shipped to you, you're able to fill it out, and we can go ahead and do that for you.
Yes, thank you, Mary, for that. I know that's always sort of the question that's top of mind, like, can we get a copy of the deck? So absolutely. And we'll try to make it as easy for you to find all the resources. We're going to add a lot of information to our toolkit too. And so we'll make sure you have that as well. So just a final note before we close out, as many of you know, this week is our week of action for Be a Hero. But as I said earlier, care planning is important always. But there is one final action that we are asking people to do this week for our week of action, and that's to participate in our social media day of action. If you head to our toolkit, there is a graphic that you can download that is fillable. You can write in your reason as to why you are making a care plan. And we are asking that you share this tomorrow or on Saturday. Saturday is actually National Healthcare Decisions Day. And we really just want to see us, just a swell of people just really talking about why they're making a care plan. We did something very similar last year. So we're asking others to join us again. And just some key dates. We are almost through our week of action. Of course, today was this legend training. The next time we will be having a call will be at the end of the month, April 28th. Will be our campaign wrap up, and that's usually where we take the time to really hear from you. Well, we may play with that date. We might schedule it a little later in May just to give people some time to do their action. So that might be TBD. I'll just say that out loud now. Just look for your emails to see when we'll schedule that. But really, thank you all again for participating. I mentioned earlier, showing up is usually the toughest part, and you all are here today, and we really appreciate it. We hope the information shared today was really helpful. There is an evaluation at the close of this webinar, so once you click out of here, there will be a pop-up evaluation with either 3 or 4 questions, and we would love your feedback. All the details that Mary shared as far as what we will be sending to you will get to you by early next week, but you have our information if you need to reach out. Thank you all again, and we hope you have a good rest of your day. Thank you.
Thank you all so much.
Steady clicking and it's not happening. Sorry.
The evaluation?
Clicking. No, leave was not working.
Oh.
Y'all have a good evening.
You too, Lisa.
That's so funny.
All right, I'll end the meeting for all now, so maybe that'll make it easier.
Okay.
All right, thanks, Mary.
Sure. Bye.
Bye.